David, St. George South, St. George North, Carriacou, and St. John St. Mark. So we have 7 districts, health districts. That's how we categorize our districts. And when you look at this pretty little slide, you may say St. Andrews is yellow, and that is significant of what? Sunshine and vegetation and all of that over there? No. We categorize them based on the immunization coverage, yes, and we look at the level of risk. So for St. Andrew, St. David, I will go back. St. Andrew, St. David, St. Patrick's, and Carriacou, they're at medium risk. So, that means that the immunization coverage falls somewhere between 80 to 70. Yeah? And there is St. John St. Mark and St. George's North, which is in a lighter, well, let's say brown, but it should have been a little bit more red. Yes? We wanted to depict a little red thing there. Their coverage is like 70 to 60, sort of. And St. George's South, it's really, really low. So they are at high risk. So St. John, St. Mark, and St. George's North are at high risk for disease outbreak. And St. George's South is at high risk. Why St. George's South is at high risk? Besides the vaccination coverage being very low, they also have ports of entry. So the airport is there, right? They have a lot of marinas. So persons are coming into the country from that point, as well as we can appreciate, if we go into the south, we have some vulnerable communities as well. So when we categorize all of that together, we can appreciate why St. George's South is at such high risk. Because if the immunization coverage is so low and persons are coming in, we don't know if these persons are vaccinated. If they're not vaccinated, we don't know what diseases that they're coming in with. They live in the hotel belt, they interact with our people, yes? And by that, we are at risk, yeah? And the immunization coverage is very low. Yeah. So what we are seeing here within the immunization program is that we are under threat. It is a need for us as a nation to be concerned, because what it tells us is that we no longer have what we used to boast of and call herd immunity. During COVID, everybody was talking about, everybody wanted herd immunity during COVID. Yes, they wanted the vaccination coverage to go up so that we can get herd immunity to help to reduce the impact of COVID. However, we had herd immunity for all of the diseases that was mentioned earlier. Measles, mumps, rubella, diphtheria, tetanus, but we have lost that. And as a region, I believe we would have lost our measles certification as well as being measles free. So it tells us that we are going downhill and not up. So I hope that you can appreciate where we are, and I'm going to ask of you tonight to ask of your neighbor to understand what and how the position in which Grenada is currently facing for vaccine preventable diseases. These diseases are preventable by having your vaccine. So why are we going to allow ourselves to have a disease outbreak in order for us to get vaccinated? We need to look at this slide. Remember this slide as you go home and be able to spread the message for us. So we want to remind you that you need to get up to date with your vaccines. But not only you, your neighbor, your family members, your children, your grandchildren. We need everyone to come out. As adults, you need to have your influenza vaccines. We have them readily available at the ministry. But at the end of the year, we have to discard them because persons are influenced sometimes by relatives, sometimes from in the diaspora as well. The diaspora have a significant impact as well on our immunization coverage. But we have to go back to trusting your healthcare provider. They are the ones that have the factual information. They are the ones that would help you to understand the importance of what we are preaching. We are not here to disguise anything in any form or any way. We cannot afford to disguise it, because look at the slide that I showed you earlier. If we continue on that trend, there is nothing to disguise. We would have so much disease within our country that there wouldn't be anything to disguise. So there is no benefit in disguising anything. So please trust your healthcare provider. Go and get your vaccines. And I keep asking parents this question, or keep the statement I keep saying to parents, because you have persons, when we speak of HPV vaccine, some parents say to us as a ministry, we are trying to expose children to sexual activities at an early age. This is not what the ministry is trying to do. What the ministry is trying to do is to protect our children for later days. The HPV vaccine is most effective before sexual activities. That's Dr. Donald? Before sexual activities. So that is why we need to vaccinate our boys and our girls at an early age, so that we can help to preserve their lives at 30 and 40 when we start seeing cervical cancer. And cervical cancer is one of the leading cause of death in Grenada. Am I correct, Medical Director? Yes. Cervical cancer is one of the leading cause of death in Grenada. And you're sad to say, it is preventable. It is preventable by having your vaccines. So I just want to encourage you to love them enough to protect them. Thank you.
Nurse St. Paul, thank you very much. Now, the things that Nurse St. Paul just said, they are so scary, I don't want to repeat them. But I want to throw this one out to the minister. St. George North, high risk. Right. So, sorry? Northeast. So he has some work to do. Right. Speak to your colleague in the South. Hi. So we have to get it done. But seriously, Nurse St. Paul just revealed a whole lot of things there that should be troubling to us, but not troubling in a sense that we become complacent and throw our hands up and decide we do nothing. Troubling enough that we should start tomorrow morning to see what we're doing in terms of not just going out and get ourselves and our children vaccinated, but our neighbors. Because the people we're speaking to in here, I know each one by face and most by name. And I know you are the converted. So go out and meet the unconverted. I'll give you two little stories before we take the very last, very important lady. Just a few weeks ago, a doctor was invited to speak to the congregation in my church. And he gave, and I'm talking here about the HPV and so human papillomavirus. And he gave us a story about parents who came in with their daughter with some pain and so on and so on. So he started asking about doing some tests and talking about sexual activity. And the father said, oh, no, she is good, she's not into that. But the next morning, she died from a ectopic pregnancy. I'm saying this to say that when we talk about vaccination for HPV and so on to prevent cancer of the cervix, it's not because you're trying to encourage the children into anything. It is because we are facing reality. We may not like it, but it happens. And it's not just about children having sex early, but it is about where the prevention starts later on in life when they become sexually active. So don't take it as a ministry trying to do something wrong to your children. The other thing is, speaking to somebody just today about vaccination and so on, the person said, oh, we don't need that. I know one person who took it and died, another one who took a vaccination and died, and everybody knows somebody who took a vaccine and died. One of our doctors said, speak for yourself. Don't speak about other people's experience. Speak for yourself. You took it, I took it, and I'm alive and kicking. Let us invite another. This one is special because she's not a medical person, but she's a parent, and I'm sure she has something to share in terms of her child or children being vaccinated and the benefits, I'm sure. But she will tell us. So let's welcome Ms. Roxanne Bola, who will tell us more about her.
Thank you. Good evening, everyone. Unlike the other speakers, I don't have a PowerPoint presentation. And I will not be as long as they have been. I am a teacher by training. I'm an administrator by practice, but most of all, I'm a parent. My son is sitting there. I know he would not be happy for me to point him out, but he's here with me. All right. I have one child, and I see my child is a gift from God. And God has given parents the responsibility to care, to love, and to protect your children. All of us who have children. God has given us health laws and things that we can do for our benefit, for our health. You know, exercise, sleep, rest, all of those things, fresh air and all of that. But God has also given us wisdom. And the wisdom that he has given man, which has led to the creation and knowledge base that comes up with things like vaccines and so to help us. Now, as a parent, you go to school, you learn and everything. And you know that there are diseases that are prevented and they are preventable. All I have to do is to get my child vaccinated. And it has been pounded more than once here tonight. The vaccines are free. I didn't have to pay anything. All I had to do was go to the clinic and get my child vaccinated. Now, I am a professional, but my training is not in the medical field. So, if I want to build a house, what do I do? Do I go and build a house myself? No. I engage an architect to design. I go to the contractor and, let the professionals handle it. I tell them what I want and they handle it. I see health in the same way. That is not my field, that is not my training. I would not pretend to know more than the medical practitioners and the medical professionals. The advice that they give didn't just come out of nowhere. It came out of research, it came out of years of study, years of practice. It was not no fly-by-night decisions. People spent time, we learned over 200 years? Right, so people spent time studying. They followed the scientific method, they did research, trial and error, all of these things happened. And I don't need to know about all of that. All I need to know is that I must do what is in my power to take care and to protect my child. And what I can do, ensure that my child is vaccinated. I thought of, what if I didn't do that? And then my child becomes sick. That's a cost to me. Doctor bill, medication, hospitalization, time away from work. I have to, all of this. And it's not the stress, not just, there's a physical stress on me. Carers have to take care of the child. That's a stress on me. an emotional stress, a financial stress, everything. So I didn't want that, so what I could do, vaccinate, and that's what I did. Another thing, I know it is the law, and I'm a law-abiding citizen, therefore, vaccinate. You know, I really, really just want to encourage parents and anybody to do what is within your power, what they call the power that whatever control you have, and that is to vaccinate. Yes, there are side effects of when he got his vaccine, you know, little irritability, tenderness at the site, you know, that kind of thing. But it didn't last forever. It didn't last long, and it soon got over it. And in my thinking, the benefits that could be had from vaccination far outweigh any little side effects that might occur. And just in one more thing, one more point, maybe that might be my last one, travel to other countries. I recall going to China to do my master's, and one of the things that I had to do, you had to show your vaccination status, all of these things. And lots of universities, and so my son will have to go off to study. I don't want that to be a deterrent for him or something that prevents him from making progress later on in his life. So that to make sure that he is vaccinated, has all his shots, everything that he needs to give him all what I can so that he doesn't look back afterwards and say, you didn't help me, you didn't do this. You know, mommy, you should have done that? No. Vaccination, as they said, each vaccine counts, and I wanted to make sure that I had mine in the right place. Thank you.
Mary, couldn't be better said. Thank you, Ms. Bola. Now, if you didn't trust the health professionals, take it from a layperson. She just said it. She said her son is here. He's somewhere around. But what I'm trying to get at, he is alive. He's very much alive. He is here with her, right? Okay, I recall one time, I'm happy to hear that the Rastas have caught on to this whole vaccine thing. I recall one time when I was working in the Ministry of, yes, I was one of them conspirators, working in the Ministry of Health, and we had one situation where a Rastafarian family didn't want their children vaccinated. It was somewhere up in Goa with St. John's, and I had to go to find these people. And you should have seen the mountain I had to climb, eh? Way up, way up. When I met the family, spoke with them, they were very receptive, and the father was telling me, we don't believe in that. We're not going to vaccinate our children. But I sat there with them and I convinced them. And the man, when I was leaving, he said, well, I'll go see. Well, I guess he saw, and he saw the light, and he must have talked to others. And now we're hearing tonight that they have come on board, but then the rest of us gone astray. So we have to try and get back to that. Okay, we have a few minutes left for question and answers. You decide what you want to ask. Make it brief for us, please. To the point, if GBN would allow me to use that phrase. To the point, and you will say who you're asking it to, and they will answer to the point, and then we'll take the next one. There's a microphone at the middle there that you can use, and we'll take your questions. I prefer if you show by raise of hand, or by lining up, first come, first serve, and ask your questions. Thank you. Yes, Ray.
Thank you. Excellent presentation, panel. Thoroughly enjoyable. There are two. You're going GBN. There are two ultra experts on the panel. Contracted to Paro, I think. Should I read anything much into it, or are there experts in each country for immunization week? is Grenada special?
Yes, it's special because I'm here.
Yeah. Yeah, okay.
Special, but it's everywhere.
So there are no other special experts in other countries, St. Vincent, Trinidad, like we have here?
No, I did some online.
You did some
virtually,
online?
And here I am here in person.
Right. And when at the end of the week, you go back?
Unfortunately.
Thank you very much. I'm sure we love having you.
Oh, that's it.
But before Minister speaks, I just, I realize where Ray is going here. The thing is, you are two of you here in Grenada. Who is in the other islands? Grenada is special. And the fact that they are here, let us not waste their time, their money, and their effort for being here with us. All that they brought to us tonight, and not only tonight, but for the week, let's make sure we use it to our advantage. Yes, Minister?
Well, good night again. Fully agree. I would just make one brief comment just to say that I intend to bring back to my neighbors in cabinet the importance of vaccination. So I would ask this question very briefly. In relation to allergic reactions to vaccines, what is the mechanism currently that any citizen can access wherever there are allergic reactions to vaccinations, just to help ease the mind? But additionally, I would like to make this point. I think part of the problem is a lack of the education around vaccinations and the hysteria that seem to have stemmed or take root in society over these things. So I would like to see PAHO, certainly once funds permit and the collaboration with the government and other stakeholders, complete series of consistent education at the school levels to help get the children in particular educated about the safety of vaccinations, the mechanisms in which you can resolve disputes, etc., whenever you have illnesses, and possibly why they need to tell their parents, tell mommy and daddy, they need to get vaccinated too, as well as getting them vaccinated as well. So thank you very much.
To answer Minister's question about the adverse reaction, I think you're speaking of, we have a monitoring system within our immunization program, and we call it, by short, ESAVI. So ESAVI are events supposedly attributed to vaccination or immunization. Because really and truly, someone may have taken a vaccine and have some sort of adverse reaction. But on investigations, you may realize that it's not really the vaccine, but it was some other reason why. So based on our monitoring system, or our ESAVI, this is where persons report. So if you were vaccinated, you're having an adverse reaction, you report it to the nearest health facility. Then that information comes into the EPI department, an investigation is done, that person is followed up thoroughly, the medical assessment and everything is done to ensure that whatever is happening there was not vaccine related, or if vaccine related, then what are the necessary steps that has to be taken. Because, for instance, if I were to receive a vaccine in Guelph and have an adverse reaction, and somebody else receive a vaccine in Grandance and having similar adverse reaction, based on that monitoring system, it would tell us which batch of vaccine that this person has received, what batch of vaccine that is causing that problem, and as a result, we now go back to the manufacturer, and so really and truly, when we preach that vaccines are safe, we don't just speak vaccines are safe. We have the system in place to ensure that vaccine is the entire process is a safe process. And as it relates to the school, yes, Minister, maybe we need to improve there. We have the nurses who go into the school periodically. I think every 3 months, we usually go into the school at some point in time, providing education. We have done education with the principals and so last year. So we do some education, but we can improve as well. What we would ask of you, though, is to help us in your constituency, to organize your population around your constituency. And we do have funds within the Ministry of Health. We have the chief planner sitting there smiling. So we do have funds within the Ministry of Health whereby we can, if you help us to organize forums, we will come, we will provide the education. So we're begging for that collaboration. Thank you.
Different country in the Caribbean, and one child was vaccinated for the same MMR, and he died. But his complications was he was autistic, and my children, both my children got vaccinations, and they 23 and 20 now. Nothing ever, no rubella, no measles, no. So the vaccination works.
Good night to everyone. My question is, seeing that these diseases have been around for an extended period of time, is there any evidence of mutation of any of these diseases? And in terms of developing the medications or other things as far as the mutation, the possibility of mutation of any of these diseases?
Question 2. Okay. So thank you for that question. And the answer is yes. So over the years, yes, you can have mutations of some of these organisms that create these infections. And of course, it even affects it affects treatment as well, because of course, medications that would normally, treat some of these illnesses, you now have to step up another notch in terms of being able to manage them properly due to resistance and so. So yes, that can happen, and that has happened. So of course, it's important that the more coverage we have, the chances for these things, will be less.
I would like to add on that the mutation occur when the disease is in the environment for long periods. They are also smart. They will be there, you give treatment, but not appropriate treatment. They will also mutate to fight that treatment. So that's when the mutation comes, when they stay for a long time in their environment. But if you have a good coverage of vaccine or good treatment, you eradicate them, they will not circulate, they will not mutate. Thank you.
Mary?
Good evening to the head table. I always feel that my question is silly, but however, I'm still going to ask. Now, the smallest of things that we take for granted are the ones that cause big problems. Now, you know that we have some people that they really don't take anything very serious. Now, can someone just go for a tetanus shot without anything happening? So if I want a tetanus shot, could I just come for a tetanus shot without getting a stab or anything?
You can walk into any one of the health facilities and you can request an update of your vaccines. When you get there, what the healthcare professional will do is to ask you a few questions as to your vaccine status. If you ever was vaccinated before, you know, how many vaccines you had for a particular disease, and then they would be able to help you to understand which vaccine that you need to get up to date with. Because you may walk in and say you need a tetanus shot, but you had all of your doses of tetanus over the years, so you may not need any tetanus vaccines, but you may need to have your flu shot.
Thank you.
Afternoon, evening again. If someone has an allergic reaction, right? Is it necessary to, or will the ministry pay attention to the batch from which they got that allergic reaction, or is it assumed automatically it's because of something inherent in that person that they have had an allergic reaction? Follow?
We cannot just automatically assume it's a batch. As I said before, sometimes adverse reaction doesn't necessarily have to be as it related to the vaccine. There might be different events happening at the same time. So that is why we would do our investigation, yes? And if it is found out that it is the batch of vaccine that has been contaminated, then the necessary action will be taken. But if after investigation we realize it's an ESAVI, it's an event supposedly attributed to, it has no cause or relation to the vaccine, then the medical practitioners would treat it in that manner. They would treat you for whatever problem that you're having.
Pleasant good evening to all, and a very good presentation by the panel. I think we all appreciate it. A question, recently I heard of, then this is could be answered true or false. Recently I heard of there's been an outbreak of smallpox in Grenada recently.
It's not true. That has no factual basis at all.
Thank you. In Grenada. I hear it in Grenada. The other thing, I heard somebody mention about vaccination being done from 1977. 1977 was the year I recall in the presentation. That hasn't been vaccination, done before that for some of the same diseases that we're talking about there?
Is the expanded program on immunization, which is a name. So that whole expanded program on immunization started in that year. But yes, there was vaccine around before that. For every program, sometimes within, not just Ministry of Health, but today we may call it the expanded program on immunization. In the next few years, they may change the name to something else and start doing different things to the program. So that program, the expanded program on immunization, really started in our region in that year. But there was vaccine before that.
They didn't have a name for those before? The fact is, I remember getting vaccine in primary school, and I've been to primary school in the 60s.
Yes, you're correct. It just didn't have a formal name then. Yes.
Is that all? Well, I know they were really very good, and you took in everything. But do we have any other questions for them? Well, Going once? Going twice? Okay, so sorry? Oh, you followed. Anything on social media? Mikey? Anything on social? Questions, comments? I guess St. Paul Sports and Culture would discuss with the Ministry of Health, and if they're talking about the next one in St. Paul's, then that will be discussed. For anywhere else in the country, the Ministry of Health will be able to tell us, so maybe I could ask St. Paul now.
Well, we are willing to go to any village that is willing to accept us. However, Immunization Week in the Americas is from the 22nd to the 29th. However, in Grenada, we plan to go through the entire year, focusing on immunization and vaccination because of our low coverage. Therefore, we'll be able to post, we have Mikey live here, so we will post our next forum, where, time, so that persons will be aware.
Great.
Measles by still contract the disease.
Okay, Dr. Charles.
I wish to, thank you. I wish to know if the person completed the series, because we have issues like that when people take the first dose and they fail to come at 18 months. Thank you.
Yeah. Maybe the person didn't say if he got, but that's why we have observed that they receive the first dose because it's at early age when the child go for follow-up, routine follow-up, and then the parent don't bring the kids to receive the second dose. And in the Caribbean region, we have observed that the second MMR vaccine is very low. We are in the 87, 86%, when we target 95, right? I wish also to inform you that although the vaccination week in the Americas is for 1 week, the World Health Organization have the whole year-round activities for improving vaccination for children, adults, so that we will have healthy communities. So, and that is called Big Catch-Up. It's gonna run the whole year as a big catch-up campaign to reach out every citizen in the country who needs vaccines to get vaccinated. So, St. Paul, we see in which community they have low coverage, and we can help to go toward those communities. As she said, any community that is ready to receive them, they will be available to come and vaccinate the children. Thank you.
Somebody says that immunization has been around since their school days. I guess they're a bit older. They want to know what's the big deal now? Why is there an extra
The big deal now is that we are at risk for disease outbreak. That is the big deal. Because back in the day, we had coverage of over 95%, which was able to protect our entire country and even assist in protecting the region. However, because of our low immunization coverage, our country is at risk. We saw it in the presentation earlier, where there is no health district that is at low risk. All of our health districts are within medium risk, high risk, and high risk. Therefore, we must continue to preach that message in order for persons to get vaccinated and protect themselves and their loved ones against these vaccine-preventable diseases.
We really need to emphasize on the risk the country are facing with re-emerging diseases. Those diseases that we have getting rid of them, they are really on our doorsteps. I will give you some example of measles. After the Americas have declared measles free in 2016, there is a steady increase of numbers of imported measles cases from WHO regions, that means from other parts of the world to the Americas, right? And then we have observed from 2017 to 2022 in Brazil and Venezuela, a lot of cases of measles. Another example is polio. We got rid of polio long ago in the region, right? The last case of polio was in the region was in 1991 in Peru, with a case suffering from polio, right? But since then, we had in July 2022, we had a case of poliomyelitis in the US, in New York, from an unvaccinated person who didn't have any history of traveling. The disease catch him in his own country, right? And then in August 2022, 2 positive samples from water, because as I said, surveillance, we test the water, the wastewater. And in Canada, there were cases of positive wastewater sites positive to polio. Recently, last month, March 2023, a new case of poliomyelitis in Peru from an unvaccinated kids who didn't travel in his remote village. So people move around. Someone can come from Peru, come here to work in Grenada, or just tourism, and bring you the disease, and vice versa. You can go there just for tourism, and you get the disease. Thank you.
Pleasant good evening to everybody. I live in the community, and as a mother, I have 3 children, and one is coming to be a teenager. But the thing I'm asking now, some children are afraid of needles. Is there another solution by oral, or is it just the vaccine through needles?
At the moment, all our vaccines, besides oral polio, are injectables or injection. So I understand how fair, but you take her to the clinic. There are nurses there who can really help to provide that level of comfort to her, reassure her, and I promise you, she would have that vaccine. Or if you think, I promise to give her myself. Take her to the Ministry of Health, and I would ensure that she have that vaccine, and you would be surprised that the needle wouldn't be so scary.
Yeah, don't be worried. I am afraid of needles too. Anybody else? Can we? Yes, Ray. He's a bit hesitant.
Just because I have not been in St. Paul's for a long time, you know what I mean? A kind of concern, not kind of, real concern about the situation in the South and your analysis. People come in, we go out, we have tourists, the economy depends on it. I suppose something is being worked on, a program being devised. Tell me something good.
Areas that we continue to do mop-up monthly because we understand the challenges there. Yes, we also I met lately with our parliamentary representative for the South, and he have committed to assist us in ensuring that we bring education to the persons in the South, And we can appreciate the people in the South. We have to do constant monitoring because a lot of them, you know, we have SGU, and sometimes you have the facilitators. They come in, they have their babies, they go out. We lose them sometimes, and all of that too can contribute to the numbers that we are seeing, right? So we do understand what is happening in the South, and we are trying our best to ensure that we conduct those mop-ups so that the South the coverage there can improve. And I want to remind everyone that tomorrow we have a massive drive, immunization drive in the South at Grandon's Pasture. So we're having an entire day there. So we're asking you to bring the children out, persons who have children or persons who are not vaccinated, bring them and get their shot. Even the adults, you can go out and get your tetanus, your influenza. We will be there from 9 in the morning until 3 in the evening.
That's good to know. Okay, I see 2 hands, so we'll take 2 more. Miss St. Louis, come forward and let us welcome the Chief Planner in the Ministry of Health, Ms. Camille St. Louis, and give her a round of applause. She was trying to say something, so I bring her up to the mic to say it.
Good night. I was just reminding St. Paul about the activity as well on Saturday in Renville, so she'll give more details about the walk. Again, it's about sensitization and getting people aware of the need for vaccination and the importance of vaccination.
Okay, so Nurse, we'll take you after Sherry, and then I think we have Wendy, Ms. Austin, you? Oh, for her. Okay, so after her, then we'll take you.
Good night. Could you just explain the difference between immunization and vaccination? Because since COVID, people have a sort of a phobia to the word vaccination. So we just need to know the difference. And I think if you use the word immunization, more people might turn out, you know? Yeah? You might have seen more people here if you said immunization, you know? It's a kind of fear in the people, yeah.
We use these 2 words interchangeably, but immunization, vaccination is the act. 2 drops of oral polio or injection, that is the act, vaccination. What the vaccine does in your system is immunizing, building your immunity, building the defense. We've put soldiers into your body to wait for bandits. Does it make sense? They bring soldiers into this hall because we have our treasures, these cameras, so we put soldiers here. They are waiting to act. So if bandits enter, they fire. So that is the immunity. We've put the vaccine. The act of bringing soldiers into this hall is vaccination. What they do is immunization. It's like those who go to booze.
So I still think that immunization is a better word that could have been used for people to turn out.
We use them interchangeably.
Okay.
No one is better than the other. They 2 go hand in gloves.
Okay. And also, I think because of the COVID situation, a lot of people, they had health centers that were closed. So a lot of children would be behind on their vaccination, you know. So I'm thinking that could cause the statistics to be a bit low too. A lot of health centers were closed and they keep having to go to another parish to get, to get their children immunized. So I think that also could be the cause
Are these health centers opened now?
Some, yeah. I'm not sure, carry all they have the stuff.
Are they open?
They're missing stuff there, so that could be a cause too.
Yeah, if they are open, please tell the community the health centers are open, they should come back.
All right. Question. That was the final one. So we can wrap up. Now, normally when we have forum at this place, I ask each participant to give one take-home message. Something, if you don't remember anything else, you should remember. So I'm going to do that starting at the other end this time. But before we go into that, there's just a few points I personally want to make. One, I want you to remember the theme or the slogan, get up to date. Each vaccine counts. And we had all the reasons why they count. And I just want to say an early thank you to each of the panelists. I don't know what words to use to show them how much we appreciate them coming, partnering with St. Paul Sports, Culture and Development Organization to bring such an important forum, an important message to us in this part of St. George. All that we got here this evening is very important information, very, very pertinent, some a little bit scary, but it's scary in a good way, so that it would help us to take heed of what we need to do, what we need to change, what we need to know, and what we need not do. We had from the economic situation, which is one that I think maybe the leaders of the country might gravitate to more than the ordinary people. They see things always in economics, where they could make money, where they could get money, where they could spend money, where they could save money. And if we take these things seriously, we could begin to realize that not being vaccinated could cost the country a whole lot of money. Just imagine having to put out plenty money to try to repair people or to make people comfortable in the situation that they have become simply because they didn't do the cheap or the free thing of just going into a health facility and getting the vaccination. Parents, the children can't walk in there for themselves. So parents, you are at the stage, the age, and the reasoning where you can do it for them. They depend on you. And let me just finally reiterate, the people at the panel. We had Ms. Roxanne Bola, a parent. Her child is here tonight alive and well. We had Nurse Hannah St. Paul, who has been working her head off to try to ensure that we are safe, and we ask you not to disappoint her. We have Dr. Kobe Jackson, who traveled all the way from Paho to grace Grenada with her presence to ensure that we get what some of the other islands are not getting. Oh. Tell us. Far from Grenada. We have Dr. Taisha Donald, who, well, she is from the area, but she doesn't live here anymore. But she's always dying to come back, so she is here. And she gave us all that is related to children, the pediatric aspects of vaccination and so on. I think it was Nurse St. Paul who gave us the economics. Yes. And then we have Dr. Ari Charles. He's also a PAHO consultant. These people could have been somewhere else. They choose to be here. You chose to be here to hear them. And for all of this and what they have presented, we thank you very much. And of course, we look forward to having you again. I need not say much more, but I will ask them in reverse order to just give us at least one take-home message, something that we will remember from this day forward. Starting with Ms. Bola. Just from where you sit.
Immunization is an act of love. As a parent, you love you immunize him.
Before I go on to my last reminding statement, I just want to inform you that on Saturday, the 29th at 3 p.m., we'll be having an immunization awareness walk from Progress Park in St. Andrews to Tivoli Junction. Also, we'll be having a mini health fair at the Tivoli RC School for children within Tivoli and surrounding areas, and the mothers as well. We'll also be having an obstetrician gynecologist there. We'll have dental service. The nurses would be out. So we're asking persons within Tivoli and the surrounding areas to come out and support. Tomorrow at the bus terminus, the nurses from the St. George's Health Center would be at the bus terminus providing vaccination and healthcare services to persons that wish to access. And at Grandans, the Limes, I think is the name of the pasture. Right. The nurses would be there from 9 in the morning to 3 o'clock offering health services and vaccination as well. I just want you to remember as you go that vaccines are safe, vaccines are effective. They have been proven over the years to be effective. It has been proven that vaccination is one of the public health most effective strategies against prevention of diseases. And I want to encourage you to love them enough to protect them.
Yes, on the perspective of WHO, World Health Organization, and the Pan American Health Organizations, we will make our efforts to make available to countries qualified vaccines so that we save lives and we will have healthier cities, healthier communities, and we can live longer. Thank you.
So I would just like to say that vaccine saves lives. Get vaxxed now.
Vaccines are free. It's your right. Get vaccinated. God bless you.
Thank you all for coming. Oh, Mikey, anybody online? Oh, okay. He is going to take it? You want everybody behind you? Okay, so don't run away yet. Don't run away. Okay, Pan American Health Organization, PAHO, is in Central America. Barbados. Sorry, Barbados. Right, yes. He wants a picture. They want a picture. Everybody come behind them. So PAHO, Barbados, head office, Washington. Right? I was thinking of something else. Sorry? Yeah. And then, so come behind. And thank you all for coming. And the next forum, please tell a friend so that you bring somebody with you next time. Don't come alone. Thank you very much. Who's taking a picture? Oh, you have something.